a medical device manufacturer in Saitama Prefecture. It's a small company of around 48 employees, but the ventilators they make have been shipped to 30 countries and regions around the world, including Germany and Canada. They're an important tool for treating premature babies at the hospital. Safely stored at the company is this.
こちらになります。
One of the company's early models developed in 1985. These were first delivered to hospitals in the U.S.
We made 85 units and sent them to various hospitals in North America for clinical trials with premature infants. It's an invaluable piece of our company's history.
Our story begins back in 1968. The Vietnam War was being widely covered on the news. Fierce conflict between the North and the South continued to play out. Far from the war zone in Tokyo, one young man followed the news intently. Tran Ngoc Phuc, the son of a wealthy Vietnamese family. He had come to Japan for university to study engineering. He majored in industrial chemistry. Phuc obtained Japanese citizenship and has also taken the Japanese name Nitta Kazufuku. Here's how he remembers things.
Japan is a highly industrialized nation. It was way ahead of Vietnam then. I wanted to study in Japan and bring that knowledge of production back to my home country.
After graduating, Phuc was hired as a trainee at a medical device manufacturer. While Phuc was the odd one out among his Japanese colleagues, he learned the job just like everyone else. But then, some startling news reached his ears. Saigon, the capital of South Vietnam, had fallen. The communist North took control of the South, merging the two countries into a single socialist republic.
I thought that this meant I could never return to my home country of Vietnam. I'd heard that intellectuals and the wealthy were being dragged out into the square. They were being killed for claiming that the people were getting exploited by the ones in control.
Phuc decided then he would remain in Japan and became a permanent employee of the company. He was given a new task, to develop a new product. What should be made? Phuc spent many days researching possibilities. A certain medical device caught his eye, the mechanical ventilator. At the time, Japanese hospitals were mostly using devices made overseas. Very few were designed in the country.
Development is a battle of wits. I thought if I was going to stay in Japan as an immigrant, if I was considering my future in this country, it'd be best for me to work on something no one else was doing. That's why I chose ventilators.
And so, a new project to develop a ventilator began. Phuc was ready to tackle the challenge head-on. Phuc's first step was to visit a university hospital. He worked with doctors to learn all about ventilators, starting from the basics.
There was a ventilator from the U.S. at the surgical ward of the university hospital. I committed myself to studying there for half a year. The commute was 3 hours one way. I used the whole 6-hour round trip to read research.
Phuc was able to create a ventilator based off his study of the existing technology. However, there was an important issue to consider: the strain that ventilators put on the lungs. A ventilator sends pressurized volumes of air about 15 times a minute. If the device was used on underdeveloped lungs, like that of a premature baby, it could cause strain on them. How could the ventilator be made gentler on the lungs? Phuc read research from all over the world. He discovered a certain paper on high-frequency ventilation. While ventilators of the time were sending air about 15 times in a minute, the paper claimed that a higher frequency of smaller volumes, around 200 in a minute, was also effective.
Researchers in Sweden had proven in an experiment with a dog that 200 smaller volumes of air a minute worked. The dog could live with air being delivered 200 times. I decided I would also explore this method.
But how could these smaller volumes be achieved? Phuc turned his attention to this component, the valve. The valve controlled the flow of the air. By manipulating how it opened and closed, he might be able to rapidly deliver the smaller volumes. Phuc experimented over and over again with prototypes. Eventually, he was able to come up with an original valve design that was able to deliver small volumes of air 900 times a minute. A new kind of ventilator which put less strain on the lungs had been made.